So yesterday I had a patient coming to see me with regards to headaches. She'd been to her GP and she was diagnosed with cluster headaches. Cluster headaches are headaches with a neurological component. So usually one-sided, behind the eye, some nausea, vomiting, very severe migraine type things. Now, neurological components of a headache like that are obviously related to here, because that's where the nerves are coming from, okay? But this patient, like every patient that would have an allopathic approach to headaches like this, would be given anti-inflammatories, muscular relaxants. If it doesn't work, they'll probably go on to anti-epileptic drugs, maybe beta blockers as well. And never, ever in my career have I had one patient sent by a GP for me to look at this, where the origin of the nerve is. Over 20% of headaches on patients are related, or classified, sorry, as cervicogenic headaches, so related to this. So it's an aberration to not see any referrals or patients as the first shot coming to see a chiropractor for their headaches. Because what would we do as chiropractors? We would run through the history of the patient. Of course, the fuel they put in their body, what they eat, what they drink, amount of water, blah, 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 blood pressure test. But we will essentially, after all this history has been taken, address this part of the neck, see if there is more tension on the right side than there is on the left side, a bit of swelling at the back of the occipital bone here. Are the occipital bone even? Is the pressure here on first, second cervical different right to left, like there's a bit of tension right here, for example? Is the first cervical laterally deviated like that due to accident, traumas, falls, of course, but birth phenomena as well? Now, so after testing all this, we would ask the patient to lie down on their back, carry on the examination with a little bit more mobility, but check also the TMJ, because that's a very important point, never mentioned in headaches as well. A bit of tension here on the right hand side of this TMJ here. Is the patient wearing a retainer? Is the patient wearing a bicarb? Are they grinding their teeth? Are they causing huge amount of tension here? On the jaw, on the temporal muscles, and therefore also refer to pain at the occipital bone here. And simply, the chiropractor would try to open up the junction between C1, C2 and the occipital bone. So a bit of traction, a bit of reflex point therapy, just pressure like this. Then they would look again at the mechanic and say, okay, if there is a lateral rotation or position of the first cervical and therefore a posterior rotation of C2 here, we would minimize that by adjustments. So what are the adjustments like? Well, they can be very light little pressure on repetitively on C1, very fine but fast thrust, or they could be a little bit more forward with a little bit of rotation. I'm not going to do the adjustment, I'm just going to show you what position I would put the patient in here to open up C2, tack, a little movement like this. So the scissors effect between C1 and C2 would reduce. The muscular tension here would reduce, the inflammatory process would reduce, and obviously the headaches would ease. So instead of using medication and getting the liver to be in overdose, I think the first approach with cervicogenic headaches, and in headaches in general, because they're often misdiagnosed, is to go and see a chiropractor and try to get this resolved before you try to treat the symptoms as opposed to the cause. Thank you very much.